Are you planning to retire in the next year? This video from the Wisconsin Department of Employee Trust Funds, or ETF, will help ensure a smooth transition of your health benefits into retirement. Most of the information provided in this video applies to state, University of Wisconsin, and local employees. Where there are differences for local employees, we will point them out. Meet Maria. She is 61 years old and nearing the end of her state career after serving Wisconsin residents for 25 years. She recently received her retirement estimate from ETF and now also needs information about her health benefits in retirement. Maria wants to know, can I continue the health insurance I have today? I already paid money towards my deductible and out-of-pocket limits this year. Do these limits reset once I stop working? If I cancel coverage, can I re-enroll later? Can I change my health plan once I retire? If my husband keeps working, should we switch to his insurance? What if I want to buy different insurance in retirement? Let's start addressing these important questions. Maria's employer-based health insurance coverage and plan design options will not change due to retirement. This means Maria, her spouse, and other covered dependents will still have access to the same doctors and other healthcare providers in her plan's network. Also, any money they have already paid towards the deductible or out-of-pocket limit will carry forward through the end of the calendar year. Maria can keep her health insurance because she's currently covered. She will remain covered as long as she pays her premiums. If Maria were not currently covered, she could take steps before she retires to become covered and protect her accumulated sick leave balance. Contact your employer benefits specialist if you're in this situation. Maria can cancel her coverage at any time. Cancellation is effective the first of the month after ETF receives the written request. As a state employee, unless Maria cancels her coverage, it automatically continues into retirement. If she decides to cancel coverage, she could re-enroll during the annual It's Your Choice open enrollment period in the fall. If Maria were a local employee, such as a school teacher in a district covered under the Wisconsin retirement system, she would need to complete a form with her employer benefits specialist to continue her coverage into retirement. She could never re-enroll if she were to cancel her health insurance. Maria wants to know if she can change health plans. Retirement alone does not provide an opportunity to change health plans. However, there are certain life events that allow for plan changes at any time outside of the annual It's Your Choice open enrollment period. Check out the handy chart about these rules in the It's Your Choice section at etf.wi.gov. Keep in mind, there are usually some program changes each year that affect all employees and retirees. Maria should carefully review the updated health benefits information during the annual It's Your Choice open enrollment period in the fall. This is when she will learn about any changes in plan options, benefits, or available health plans and providers. Looking a few years down the road when Maria turns 65, her plan options will change. She will need to enroll in Medicare. Check out the New to Medicare video for more information. Oh, Maria also asked about switching to her husband's health plan. Since her spouse is still working, they can switch to his health plan. Before doing so, they should each talk to their employer benefits specialist, as there are some things to think about. For example, they will need to pay attention to his plan's enrollment dates. They will not have an automatic enrollment opportunity solely because Maria is canceling her coverage. Finally, Maria wonders if she should explore coverage options besides those offered by her employer. She can always review options available in the health insurance marketplace. If she chooses a plan from the marketplace, she should consider how the benefits and costs compare to the plans available through her employer. She will also need to be aware of the open enrollment dates. If Maria decides to cancel her current coverage through her employer, it will be important for her to protect or escrow any accumulated sick leave credit. Local employees do not have sick leave credits, but may have other resources available through their employer to help pay for health benefits in retirement. A benefits specialist will have all the details. Remember, if Maria were a local employee, she should consider this option carefully because if she cancels coverage, she could never re-enroll under her own plan. Maria feels reassured now that she knows more about her health benefits in retirement. And we hope you do too. If you do have questions before retiring, contact your employer benefits specialist. After retiring, contact ETF. To learn more, check out the health benefits videos in our Retirement and Medicare series. And don't forget to stay connected with us for important and timely benefits information.